If you have ever had to suffer through a bout of severe lower back pain, you know just how horrible and scary those symptoms can be. So let me share with you a few self-treatment methods that you can do at home the next time you find yourself experiencing severe symptoms like that again. While many people suffer mild low back symptoms every day, the particular type of pain episode that we're talking about here comes on rather quickly and suddenly, and is typically a result of repetitive forward bending, hunched over postures, or even lifting an object from the floor, and these symptoms are usually described as sharp, stabbing, and shooting. While this type of symptom is typically localized in the low back, it can radiate down into the buttocks, the back of the thigh, back of the leg, and even down into the foot. At its worst, it can be described as an electric shock-like pain that shoots down the entire lower extremity. Often, your mobility will be severely restricted, and you'll find it difficult to move or change positions. Similarly, you may find it difficult to stand up straight immediately, and you'll be stuck in a hunched over position for a while. Finally, you may find that historically restful positions like lying on your back or just simply sitting down are no longer comfortable and may actually worsen your symptoms. If those descriptors accurately portray an episode that you or a friend had experienced in the past, or maybe are currently experiencing, then please follow these simple instructions that will allow you to decrease your pain and get you up and moving as quickly as possible. Now this may sound strange, but having a good understanding of your pain episode is vital for effectively managing your severe acute pain symptoms. Now this type of acute pain that you're experiencing has a major chemical inflammatory aspect to it, which is just a fancy way of saying that there's definitely some swelling and inflammation involved. This particular region that is problematic is now hypersensitive. This means that typically non-painful postures and movements can now become very uncomfortable and even exceedingly painful. The really important thing to understand is because of your heightened pain sensitivity, the severity of your symptoms often does not correlate to the severity of your problems. This means that even though your current pain levels are very high, you are likely not seriously injured. And the good news is that your body repairs inflammation all on its own, which means that those sensitivity levels will decrease soon along with your acutely painful symptoms. Remember, understanding how your body reacts to and deals with pain is a key part of the healing process that is necessary to diminish the anxiety and stress that often accompanies severe painful symptoms. So knowing what to expect from your painful episode can directly diminish your anxiety and stress, which also decreases your sensation of pain. Now that you have a better understanding of what exactly is happening during your severe pain episode, here are some practical tips that you can use to manage these symptoms. Primarily, we want to invoke the use of something called active rest. This means that even though you're experiencing severe pain, you're not bedridden. We would much rather have you be up, active, and mobile while experiencing some discomfort rather than being fearful of movement. So this means feel free to get up, move around, go for a walk, even a light jog, just as long as your symptoms are not significantly worsening as a result. The use of ice packs, hot moist packs, or even topical analgesics can also be attempted. The rules with these things are 20 minutes on, 20 minutes off. You could do them 1,000 times a day if you wanted to. My particular rule is that try it for a day. If you feel like it is actually helping, continue doing it. If you try it for a day and your symptoms don't seem to change very much, then either try something else or just stop wasting your time. Now, since we're dealing with chemical inflammation, you will also require some natural anti-inflammatories, which are usually preferable to their over-the-counter pain medication counterparts that typically have harmful side effects. Things like omega fish oils and turmeric are often recommended in situations like this. One key factor or tip is quality is key. So understand what brands you're using and maybe not go for the generics at this time. Finally, We are going to follow what's called the no worse rule. This means that whatever activity you attempt or resting position you attempt, we don't want to see your symptoms significantly worsen. Now we have two definitions of worse. The first involves the pain scale. We don't want to see your symptoms jump by more than 2 points on a scale of 1 to 10. So for example, if your current pain levels are a 4 out of 10, and you attempt some stretches, or you go for a light walk, if your symptoms jump to a 6 or more after your activity, then unfortunately your symptoms actually did worsen and you want to take a break. Now, if it only jumps 1 point, that's acceptable for now because we would rather have you up and moving. The second definition of worse is radiating symptoms. So for example, if your current pain is only located in your low back and you attempt some activity and afterwards your symptoms are now located in the butt and the back of the thigh, those symptoms have now radiated, and that is the definition of worse. Just the opposite, if your symptoms are actually located down in your leg and you do some activity, you try some stretches, and afterwards your symptoms actually centralize and come up towards your low back and are no longer located in the leg, that is actually a good positive sign. We want to see the symptoms centralize and come back up towards the center of your back. So follow this no worse rule in all the activities that you attempt for now. Now, I know severe low back pain episodes can be extremely frightening, so I hope everyone got some great useful tips out of our talk today. If you are experiencing severe lower back pain and would like a professional evaluation and treatment that comes directly to your home or place of business, please click the link in the description below, and I'll see you soon.